This instructional video will demonstrate the recommended application and removal of the Manoshield disposable catheter sheath for use with Manoscan 360 high-resolution esophageal manometry catheters. Maintain and refer to the instruction card supplied in each box of Manoshield catheter sheaths. Before beginning the procedure, be sure to thoroughly wash hands and apply gloves, following your facility's procedures for infection control. Application of medical-grade talc. Before the talc is applied, use one of the provided antiseptic wipes to wipe the full length of the catheter. Rotate the catheter and wipe again. Use the supplied wipe only. Set it over a clean toweled bedside table or workstation until completely dry for a minute or two. Warning: failure to allow the catheter to dry completely may cause clumping of talc and subsequent errors in manometric pressure readings. A thin, even coating of the supplied talc lubricates the catheter's surface and facilitates application of the Manoshield to the catheter. With the catheter on a clean, toweled, flat surface, gently fold the supplied talc-infused sponge over and around the Manoscan catheter near the 100 centimeter mark. Slide the talc sponge with light, even pressure down the length of the catheter to the tip. Do not allow the catheter to touch the floor or other surfaces. The goal is to apply a light, even coating of talc along the entire length of the catheter. Manoshield Integrity Test. Pick up a Manoshield and let it hang down toward the ground. Do not let it touch the ground. Hold the Manoshield at the blue cuff with one hand and pick up the supplied syringe bulb with the other. Gently squeeze the blue cuff open if it is pressed flat. This makes it easier to fit the bulb and insert the catheter. Insert the tip of the bulb into the opening of the Manoshield and squeeze in a small bit of air to inflate the Manoshield. Pinch off the top of the Manoshield and look to be sure the Manoshield remains inflated for no less than 5 seconds. A tear or leak in the sheath will cause deflation of the Manoshield. If any leaks are suspected, discard the Manoshield and use another. Application of Manoshield to the Manoscan catheter. Either while standing or working with the catheter draped over your clean, flat work area, hold the Manoshield near the catheter tip and carefully insert the tip of the catheter into the sleeve. Slowly slide the catheter into the sleeve, guiding it along the length of the sleeve. Be careful not to apply too much localized pressure to the sensors during the Manoshield application. Stop when the catheter reaches the blue dot near the distal end of the Manoshield. There will be some slack sleeve at the end. Pinch the slack sleeve tip to remove all air and bend the tip of the sheath back over the blue dot. It is not an issue if the blue dot falls off. Hold the bent sheath tip in place while picking up the blue slider with your other hand. Both hands should still be clean at this point. Removing air from the Manoshield. This step ensures that any trapped air inside the sleeve is removed. Trapped air will show as artifact on the software. Holding the plastic blue slider with the silicone tab pointing away from the catheter, gently insert the distal tip of the catheter with folded back sheath tip into the slider. In a smooth motion, pull the slider up the entire length of the catheter until it reaches the blue cuff of the sheath. Do not pump the slider back and forth. Straighten out the sheath if it bunches up, then proceed with the slider. Warning: do not move the slider past the blue cuff of the sheath. If the slider passes the blue cuff, the sheath and slider must be removed and reapplied. Holding the blue part of the slider, grasp and stretch the silicone tab and wrap it 3 times around the catheter and bottom of the slider, and secure as closely as possible to the blue cuff by inserting the hole in the tab over the peg button on the slider. If the tab is not secured against the base of the slider, it may cause the catheter to bend. You are now ready to pressure calibrate the catheter and then intubate the patient and perform the procedure. It is recommended the sheathed catheter be used for a study within 20 minutes of applying the sheath to avoid any sheath relaxation and spontaneous reinflation of air between the sheath and the catheter. It is not uncommon for the initial pressure calibration to generate an error with a properly applied and snug-fitting Manoshield. Simply press the Start Calibration button again. Use half-inch micropore plastic tape to secure the catheter to the patient's nose. Do not use paper or silk tape, as they are difficult to remove from the Manoshield and may cause a tear in the sheath. After the procedure, removal of the Manoshield. Designate one dirty hand and use it to remove the tape from the catheter and patient and extubate without touching the sensors. Dangle the catheter in the air while still recording to enable a thermal compensation application in the analysis program. While the catheter dangles freely, use the designated clean hand to stop the recording and save the study to file. Do not let the contaminated portion of the catheter touch the clean portion of the catheter. No external pressure should be applied to the catheter after extubation during the dangle for a few seconds. Then the catheter may be placed on a protected surface, avoiding contamination prior to sheath integrity testing. Detach and unwrap the silicone tab from the slider. Lightly hold the ruled tubing section of the catheter and a blue cuff of the Manoshield together with a clean hand. Be sure the tip of the sheath is secure, and with the designated dirty hand, pull the slider down the length of the catheter and off. Take care not to allow the Manoshield to bunch up in front of and under the slider, as this may make the slider removal difficult and may damage the permanent outer sleeve of the catheter. If the sheath bunches up a bit, gently pull the distal tip of the sheath to straighten and ease the removal of the slider. Dispose of the slider. Loosen the blue cuff part of the catheter by moving it down a bit and slowly work the Manoshield down and off the catheter by gently pulling the distal tip of the sheath with your dirty hand. Do not bunch it up. Work it off gently so as not to cause a tear. Do not touch the catheter with your designated dirty hand. Place the clean catheter on a clean toweled area or clean disposable hospital pad. Do not place the catheter in a clean area such as the pressure calibration chamber in case the sheath integrity has been compromised. Manoshield integrity test. Once the Manoshield is removed, test it again for patency by gently inflating it with the syringe bulb. Pinch the inflated sleeve at the top and wait no less than 5 seconds to be sure the sheath does not deflate. The sleeve should remain inflated while pinched off. Note that a flaccid sleeve or a small visible poof of talc escaping the sleeve is an indication of contamination. If the sheath does not pass the integrity test, the catheter must be properly disinfected before use on the next patient. High-level disinfection is recommended for the catheter every 30 days, even if all sheath integrity tests have passed. After the integrity test is complete, discard the Manoshield. Wipe down the catheter. With clean hands or while wearing clean gloves, drape the catheter across a flat, toweled area or on a disposable hospital pad on your work area. Wipe it down using the second supplied antiseptic wipe. Take care to not let the catheter touch a dirty work area once it has been wiped. Once dry, the catheter is ready to be safely stored in the provided molded catheter tray in the blue catheter case and used again for the next procedure. Esophageal catheter care. Handling and storage. This catheter is a delicate instrument, protected from sharp objects, abrasions, squeezing, pinching, excessive bends, or contamination. Do not pull on catheter or stretch the outer sleeve at any time. Do not use endoscopic snares, forceps, sutures, or other tools that could damage the outer sleeve to assist with intubation. Store in molded tray in protective case. Connecting. Grasp the outer shell of connector and pull straight out or push in with the keyed red dot up. Do not twist the connectors or force the connection. Calibrating. Ensure the catheter is inserted to the 42 centimeter mark within the calibration chamber. The calibration chamber seal knob should be thoroughly unscrewed to allow free insertion and removal of the catheter. Assure the permanent outer sleeve is not wrinkled at any point, preventing the safe insertion into and safe removal from the calibration chamber. Patient intubation and catheter placement. Do not use silicone-based lubricants for intubation. Assure the catheter does not double back inside patient, evidenced by a symmetrical pressure pattern. Pull back until it straightens out. Cleaning and disinfection. Do not ultrasonically clean, autoclave, use ionizing radiation, or any unauthorized cleaning or disinfecting solutions. See Manoscan manual. Gently clean with warm water and an enzymatic detergent such as Enzol before disinfection. Tested and acceptable disinfectants: Cidex Plus, Cidex OPA, Tristal, Corsilex Basic, Corsilex Ready to Use, Gigacept FF, Secucept Plus, Sporox 2 TD5. Tested disinfectants not to be used: Cidex PA, Sterilox. Follow the disinfectant manufacturer's directions for use and do not exceed the maximum soak time. Rinse gently but thoroughly with warm water after disinfection. Do not pull on outer sleeve during cleaning. Dab the catheter dry. Assure the metal connectors and the Y-split remain dry at all times.